So this video is about hepatorenal syndrome. Remember, this syndrome is actually a diagnosis of exclusion. We'll understand why. So hepatorenal syndrome is actually a hepatic disease which is leading to some renal pathology. The hepatic disease we are trying to talk here is cirrhosis, which is end result of every chronic liver disease. Okay, so cirrhosis actually can lead to portal hypertension, and this portal hypertension we know is characterized by splanchnic vasodilation. Since this splanchnic vasodilation will pool the blood in the splanchnic circulation, less of it will return to the heart. Okay, because less of it returns to the heart, there will be decreased preload and afterload, and this will activate the RAS mechanism, which will increase the level of angiotensin 2, and that is, it will increase the sympathetic effect. And here is the renal pathology coming in the action. That is, because of this increased angiotensin 2, we will have intrarenal vasoconstriction. So the pathology in the case of hepatorenal syndrome is an intrarenal vasoconstriction. Okay, let's try to understand the basics. Let's try to add up on this. So we have cirrhosis, and this cirrhosis is the end result of every chronic liver disease. Maybe mostly these are because of an alcoholic reason, but it can be because of non-alcoholic reason like hepatitis. It can have metabolic causes like Wilson's and say hemochromatosis, or it can have autoimmune causes and whatnot. So finally, cirrhosis leading to portal hypertension, leading to splanchnic vasodilation, and activating the RAS, leading to intrarenal vasoconstriction. This intrarenal vasoconstriction is going to manifest as a pre-renal impairment. Now remember, there are many causes which are more commonly causing this pre-renal impairment rather than this hepatorenal syndrome. Though 18% of patients of cirrhosis can land up in hepatorenal syndrome, pre-renal impairment, which is the symptomology of this hepatorenal syndrome, has many other causes. And of these other causes, we have three important causes we need to exclude. One of them is GI loss. We have hypoalbuminemia, and we have diuretic overdose. So whenever talking about hepatorenal syndrome, we know it is a pre-renal impairment which needs to be differentiated, or we need to exclude other causes of pre-renal impairment, that is GI loss or hypoalbuminemia or diuretic overdose. So now when we define a hepatorenal syndrome, we need to remember 2-3 things. So we are talking about hepatorenal syndrome. At the same time, let's talk. We have two types of hepatorenal syndrome, a type 1 and type 2. Type 2 is characterized by a refractory ascites, which is not going to respond to normal drugs used in ascites, and it has a longer duration, or say it has a median survival period of around 4 to 6 months. Whereas in this case, we have a median survival of 4 to 6 weeks, and it is characterized by bad prognosis. Remember, we defined some criteria for HRS. These include, we have already discussed all of this. So we have a patient of cirrhosis with functionally abnormal kidneys. But remember, structurally kidneys are absolutely fine. Urine analysis will be normal, but the patient will have two more things. But we need to exclude other causes of pre-renal impairment. We discussed GI loss, hypoalbuminemia, and diuretic overdose. Okay, so these things we must know about HRS. Also, HRS is a diagnosis of exclusion, plus HRS, the treatment of choice is transplant if possible. So these were bits about hepatorenal syndrome. Hope you liked it. Thanks for watching.